How will Africa deal with coronavirus? The pandemic is slowly reaching the continent, but with poor public health care, weak infrastructure, and an inability to enforce lockdowns, what's the impact going to be? This is Inside Story. Hello and welcome to the programme. I'm Peter Dobby. Now, it's taken the coronavirus longer to reach Africa than other parts of the world, but experts are warning of a possible large-scale outbreak on the world's poorest continent of 1.2 billion people. And if Europe or the US were struggling to contain the pandemic, the potential consequences across that continent are possibly devastating, if not catastrophic. One example, Mali has 56 ventilators for a population of 17 million. Africa is still reporting low numbers of cases compared to Europe and China, but that could change and change fast. Coronavirus has reached almost every nation on the continent, and as you see there, the infection rate and the death rate, well, they are both increasing. For most of the African countries, the question now is not how and when do we test. At the moment, they simply can't. The question now is when do people start dying? South Sudan was the latest African country to report its first case on Sunday.
The public health laboratory tested and confirmed a case of COVID-19 in an individual. The suspect presented to the UN clinic on the 2nd April 2020 with fever, cough, headache, and shortness of breath. The government urges members of the public to strictly observe the rules of social distancing.
Well, strict measures are already in place in many African countries, including South Africa, Rwanda, Kenya, and the Democratic Republic of Congo. But social distancing and self-isolation are nearly impossible in these informal settlement countries and towns. Many people also don't have access to soap and water. And healthcare systems in many African states are among the weakest anywhere in the world. Malnutrition and disease are already commonplace. And aid workers in Nigeria and elsewhere say millions of displaced people living in camps are at risk of becoming infected. A nationwide lockdown in African countries means millions are unable to work. That's especially hard on poor people trying to feed their families. Experts warn up to 10% of the continent's gross domestic product will be wiped out. And many African countries do not have the financial power to counter any economic slump. They also face being shut out of debt markets already struggling because of the pandemic. World bodies have pledged billions of dollars in financial aid for the developing countries, but that is unlikely to be enough. Some governments are trying to extend aid to the vulnerable, and food is being distributed to around 1.5 million Ugandans. Okay, let's get going. Let's bring in our guests. Today, they're joining us from Abuja. We have Abdul Salami Nasidi. He's the Provost of the College of Health Sciences at the University of Africa in Bayelsa State in Nigeria. In London, we have David Heyman. He's a Professor of Infectious Disease Epidemiology at the London School of Hygiene and Tropical Medicine. And joining us today from Nairobi, we have David Owiro. He's the founder and principal consultant at the Africa Development Think Tank. Gentlemen, welcome to you all. Abdul Salami Nasidi, coming to you first. Why is this virus taking longer to get a foothold across the continent of Africa?
Well, this is a very tough question, but that's a question all of us here are asking. First and foremost, maybe we should go back a little bit to the history of the coronaviruses. It seems the previous viruses that caused the two outbreaks of SARS, the severe acute respiratory syndrome outbreak, and the second Middle East respiratory syndrome outbreak, both seem to spare Africa. And it seems it's either by ecological factors or some other factors that we are not very sure of. So also is the novel coronavirus. It seems to be going around Africa, and the trickling cases we're seeing so far are all connected with imported cases from the developed countries of Italy, the first case in Nigeria, and then, of course, Egypt and Algeria, and then subsequently from France, from UK, particularly the Nigerian cases that came in the last 2 weeks, and of course now the US. So we don't know what could be responsible for this. And also the cases that we are seeing so far are few, but this could be due to maybe the fact that the tests being carried out are not many because of lack of sufficient test systems.
Okay, let's go to Nairobi. David Awiro, if it's taking its time to get a grasp of the African countries, is that maybe good news in one sense because it gives the relevant medical authorities and the governments time to prepare?
No, it's certainly not good news because if indeed already we have higher levels of infections on the ground than what has been tested, then essentially our public health systems will be overwhelmed whenever these emergencies, particularly to do with respiratory disorders, come in place. And so it's certainly not good news. But for African nations, we certainly have had a chance to learn from other country experiences to better prepare in terms of our response, particularly to do with issues to do with behavioral change to mitigate the spread of the disease. So certainly we do have some headroom in terms of learning from what other country experiences have already gone through.
David Heyman in London, from your point of view and from your skill set, is this a triple whammy in as much as we've been reporting a lot here on Al Jazeera about the outbreaks of cholera across Africa, about the outbreaks of measles across Africa, and now they've got coronavirus heading at them as well?
Yes, Africa has several different public health issues going on at the same time, which is difficult. On this particular outbreak of the novel coronavirus, COVID-19 causing virus, it's possible that Africa may be spared more than the rest of the world because they do have a younger population. And this infection is less severe in younger populations. And as we've heard previously, it's not really clear whether or not this will take a foothold in Africa. What I think is very important is that Africa knows how to deal with many of these outbreaks, and I look at the Ebola outbreaks in particular. If you talk with Moyembe, Jean-Jacques Moyembe, who was the first medically trained doctor to see Ebola in 1976, and who's gone to most outbreaks in DRC since then, his tactic is not to treat this as a biomedical issue, but as an issue that involves the communities. And so his first stop when he goes to an outbreak, and I've been on several with him, is with the district commissioner, and he says, let's get all the community chiefs together first and let me explain in their language what's going on. And he does. He tells them, you have the power to stop this outbreak if you understand two things. Number one, that these people who are sick in their own context are filled with evil spirits trying to get out. And if you touch them or their dead bodies, those spirits will come into you and you will become sick. And you need to take that message back to the community, help them understand how they can work to help the teams that are coming to stop the outbreak. So Africa has the power within its communities and its community organization to deal with these outbreaks. And hopefully we'll use that in this case if this does become a major pandemic throughout Africa as well.
Abdul Salami, coming back to you there in Abuja, is another issue that the infrastructure, the medical infrastructure, is weaker than most other places in the world. So even before you get to treatment, the idea of monitoring and tracking people is very difficult anyway.
Yeah, that is absolutely true. That was the story of Africa, particularly before the Ebola outbreak. But I can assure you that with the advent of Ebola, the African continent woke up. So it was like a wake-up call for the continent. And we started pushing what we needed to do before, that is to strengthen our health system by establishing national public health institutes. For instance, in Nigeria, we started by establishing our own CDC, that we call Nigeria CDC. And that was used to effectively fight the Ebola when it came to Nigeria. Our record was declared by WHO as a piece of epidemiological survey that was carried out by any country. So, which means, we could do things that we were never expected to do before. So, establishment of these national public health institutes have empowered us to be able to identify cases early, diagnose these cases by ourselves. We don't wait for anybody to tell us, to help us diagnose those cases anymore. And at the same time, to do tracking effectively, contact tracing. So with that, we could, empower many African countries. So following the success of the Nigerian CDC, the ECOWAS countries in the West African region deemed it important to establish a regional CDC, and that was done successfully. Now we have ECOWAS regional CDC that is doing similar things at the regional basis or zonal basis. And this was immediately also followed by the African Union, saying that, the whole continent should have, a public health institute. So this led to the establishment of the African CDC.
Let me just boil some of that down and go back to Nairobi. David Awiro. David, how do different African countries work with their neighbours if they choose to, in as much as there is a certain resistance coming from certain presidents and prime ministers? Burundi only reported its first 2 cases on March the 31st. And the official line, they put out a communique saying, we've only had 2 cases because we put God first. Surely this has got nothing to do with the Almighty. This is to do with the science. This is to do with the medicine.
Yes, certainly. As you know, most the approach that African nations have taken have actually been differing from a country-to-country basis. And so the Burundi case, of course, is much dependent on the Burundian authorities and the stance that they took. Before that, there was a comment which was widely circulated on social media that the reason why Burundi had such low numbers was because they didn't have the testing kits in place. And, just to reflect the challenges that most African nations are facing, essentially to do with capacities for testing, as well as the limitation that they have in terms of the public measures that they put in place. But certainly we see now most countries within Africa implementing either partial lockdowns or curfews and quarantine measures in place, essentially to try and bring down flattening the curve, so to speak, so that the public health systems are not overwhelmed. It remains to be seen the effectiveness of this, since we do not know the true number of the rates of infections. And so we can't really trust the figures that we are seeing being reported currently, because there's limitations to do with the testing capacity and also the modalities upon which they're doing the testing. In some cases, we are seeing them, confining the testing to people perhaps who've traveled to countries or who've been in close contact with individuals who've had positive test outcomes. But really, those modalities are not so well laid out, and so we cannot speak as to the effectiveness of the numbers. But certainly it remains
Can I just sort of move that on to David Heyman in London? David, when it comes to those modalities, when it comes to the testing capabilities, if we talk about Kenya, if we talk about Ethiopia, if we talk about Sudan, they have big camps for either internally displaced people or people who've been displaced from other countries. Is it a given that the curve will flatten out before those camps become coronavirus hotspots?
It's not a given. Clearly, it's not a given that any part of Africa will be spared from outbreaks should this disease begin to transmit rapidly in Africa, as it has done in other countries. I think there's some interesting events occurring in Africa that, at least at present, there's not been a large amount of mortality among the elderly that's been seen or at least identified as coronavirus in capital city hospitals. That's certainly the first place to look to see whether this outbreak is affecting people. And if it affects people in hospital settings and in the general communities, it will certainly affect refugee populations. And as you know, refugee populations are, according to UN agreements, to be treated within the same health systems as our nationals. But this is often very hard to do. And it is often the situation that refugees are treated differently in different health facilities. Whatever the conditions are and whatever the arrangements are, it will be necessary to look out for refugees as well as for national populations.
David Owiro in Nairobi, returning to you if I can, please. Is there a chance here that 6 months down the line, the coronavirus aggravates a delicate kind of pre-existing economic situation? You know, tourism, according to the World Travel and Tourism Council, tourism across Africa sustains 24.5 million jobs. A lot of them are in Kenya because of your beach resorts, because of your safari industry, you know, which is absolutely wonderful. But if no one's traveling, if no one's getting on a plane, those jobs have gone and they won't come back.
Certainly, the economic impacts of this are actually going to be quite devastating. If you look at African nations, mostly are comprised of a large informal sector. And having a large informal sector, it means that people have to essentially go out every day to earn whatever little incomes that they're earning. And so the moment you have this quarantine measures, partial curfews and all that being put in place, you bring many sectors to a halt. And so specifically to the tourism industry, we are seeing hotel industry and hospitality industries sector in general actually putting on hold or closing down their facilities, some even going to the extent of laying off their workers. And it will not only result in loss of incomes, but also just dampening sector growth across the economies in terms of its multiplier effects. And we are talking about, wiping out almost half the GDPs of entire nations. And so this is quite worrisome, and it calls upon national governments to put in place safety nets and cushion measures to protect not only the workers in those sectors, but also to safeguard incomes to certain levels for critical sectors of the economy.
Abdul Salami Nasidi, how do the relevant medical authorities prioritize here? Because presumably they will have to. We're talking about a part of the world where 38, almost 40 million people have a compromised immune system anyway because of HIV/AIDS. So the starting point for providing medical care is so complex from the get-go.
Well, I'm very happy to at least to note that the African countries that I know, especially Nigeria and others, have given the coronavirus COVID-19 outbreak top priority, to the extent that most of the countries are repurposing, health infrastructures that were hitherto used for other diseases to fight this disease. So, for instance, we in Nigeria are effectively repurposing all the infrastructures we used to fight polio and the Ebola to effectively position ourselves for any possible surprise, that the COVID-19 could spill on us. So I'm aware that the ECOWAS regional countries are doing the same. Ghana is very active and very proactive. In fact, luckily, the countries are now having their leaders, the heads of states, the presidents, taking charge of this fight. So the ignored aspect of our health system, which was mostly the public health aspect, is now being strengthened by all the countries. I think this is a new development. And we also have our partners, our friends that are always there to work with us, even though most of the countries that were helping us before are also having their own problems.
To go David Heyman in London, staying with that idea of polio, we also, this time yesterday, were talking about yellow fever. What's the chances here that the coronavirus will morph from being a pandemic to being endemic in certain countries. So in a year or 5 years, we'll have a conversation saying, someone say, oh, you're going to country X, remember the coronavirus issue there, it's still there.
That's a real issue, but it wouldn't be just endemic in one country if this is a virus that's destined to become endemic. It would become endemic everywhere where it's been transmitting, and that's pretty well throughout the world, just like HIV. HIV was an emerging infection in the early 20th century, and now it's endemic throughout the world. So if this virus is destined to become endemic, and we don't know that for sure, we don't know its future, but if it is, it would certainly not just be endemic in one country, it would be endemic in many countries and cause a constant health threat.
David Owiro in Nairobi, is there another aspect to this? And it might be that other countries who generally would donate to such a big need in Africa can't, because they, for understandable reasons, they're focusing on their own communities, they're focusing on their own towns and cities.
That is certainly the case. If you look at the traditional donors or donor relationships that Africa has with the rest of the world, those donors tend to be drawn from areas where the pandemic is already has already spread, and therefore those traditional donors who would have perhaps provided funds for Africa to tackle and to put in interventions to manage the pandemic are now concerned with their own domestic issues. So that is certainly something that we've observed. It therefore calls for African nations to look domestically into their own economies to raise this additional monies or funds that would provide sources for mitigating the measures that they're putting in place. And so one of the things that has been discussed at length is African countries coming together at the AU level, holding discussions with the UN in order to have another HIPIC initiative, which is essentially for low income and LDC countries to sort of have debt relief efforts so that they can be able to have greater fiscal space within their economies to borrow more and to put those funds towards putting in place mitigating measures. The other second level, of course, that have come in place is to essentially for African nations to suspend their debt repayments, essentially to put in place a debt moratorium so that whatever funds that African nations had put in place to submit in terms of debt repayments, for those to be rediverted to handling the domestic challenges and mitigating the economic negative effects that are as a result of the pandemic.
Let me just put the very final point to Abdul Salami Nasidi in Abuja. Very, very briefly, Abdul Salami. Is money enough? We've got the Ethiopian Prime Minister, the award-winning Ethiopian Prime Minister, in 30 seconds, please, saying he wants to see the continent getting $150 billion US. Is money the answer, or is it how that money is used?
Well, definitely with the situation we are now, empowered Africa will be positioned to fight the outbreak. But in a situation where the money is, there's paucity of money and economic weakness, definitely, our ability to fight this disease, this pandemic, as the developed countries are doing, will be limited. So therefore, definitely there should be a need of for an African fund, as proposed by the South African president, and also some of the moratoriums now being put forward by the Nigerian government, and the money is made available to cushion the effect. And we think this is a very good way. The Ethiopian president, the Nigerian president, and Ghana and South Africa are championing this. Look inwards, raise what you can raise, and then see what can flow in from outside.
Okay, gentlemen, we have to leave it there. Thank you so much for joining the conversation today. Thanks to our guests. They were Abdul Salami Nasidi, David Heyman and David Owiro. And thank you too for watching. You can see the programme again anytime on the website aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also carry on talking on Twitter @AJ Inside Story, or I'm @PeterDobby1. from me, Peter Dobby, and the team here in Doha. Thanks for watching. I will see you very soon. For the moment, bye-bye.